Hello, everyone. Good morning, good afternoon, good evening from wherever you're joining us in the world. Thank you for joining for our Health Insurance for Grads webinar. We're just going to give it a couple of minutes. I see there are still some students that are trickling into the room, so we're just going to give it a couple minutes before we get started. And I want to first apologize for my lack of working camera this morning. I'm having some technical difficulties. So my name is Maya Bashar. I'm the one who's speaking right now, but you can't really see me. We have lovely speakers that are joining me today. I have Elizabeth, Victoria, and Sarah, who I'm going to let all introduce themselves as we get started with our presentation. But we're just going to give it a couple more minutes for students to join in, and then we'll jump right into it. All right, I think that we can get started with our presentation. So again, to everyone who's just joined in, my name is Maya Bashara. I'm a student life associate with Campus Life and Engagement. I apologize for my lack of camera this morning. I'm having some technical issues, but I'm joined today with Elizabeth, Victoria, and Sarah, who are going to give you a presentation on the health insurance for grad students. So I'll let them each introduce themselves. Victoria, do you want to go first?
Yeah. Hello, everyone. My name is Victoria. I'm a service representative at the International Student Services Office, and we administer the International Health Insurance Plan for international students.
Thank you so much. And Elizabeth?
Yes, good morning, everybody. My name is Elizabeth, of course, and I work for the Student Wellness Hub, which is the clinic on campus. And I'm here to present together with Victoria on accessing healthcare at McGill briefly, and also within the community of Montreal.
Thank you so much. And Sarah?
Hi, everybody. My name is Sarah. I work at the Postgraduate Student Society as a Society Affairs Manager. So I support the graduate students delivering various services, including the PGSS health plan and the dental plan. And I'll explain a bit more about all those services later.
Thank you. Well, we are very excited to have you join us today for this info session, and congratulations to you all on your acceptance to McGill. We hope that you have taken the time and opportunity to celebrate this major milestone. So before we get started, I just wanted to ground today's session with a territorial land acknowledgement. So land acknowledgements might be new to some of you, so I just wanted to clarify a little bit what they are. Essentially, they bring awareness to Canada's colonial history and acknowledge Indigenous communities who are still active on this land. They also work towards reconciliation between institutions, individuals, and Indigenous communities. If you're ever interested in learning more about land acknowledgements, Canada's Indigenous communities, and the history of colonialism in Canada, you can visit native-land.ca. So McGill is on land which has long served as a site of meeting and exchange among Indigenous peoples, including the Haudenosaunee and Anishinaabe nations. We acknowledge and thank the diverse Indigenous peoples whose presence marks this territory on which peoples of the world now gather. So just a couple of quick housekeeping items before we get started. You have access to the Q&A to ask your questions. Feel free to ask any questions that you may have throughout the presentation. We are going to take some time at the end of the presentation to answer all of your questions. You may have noticed all of your microphones are currently off, and this is to ensure good sound quality as this meeting is being recorded. The slides and the recording from this presentation is going to be accessible to you on your applicant portal after the presentation as well. So I want to talk a little bit about Campus Life and Engagement, or CLEI for short. Essentially, we are here to help you build a sense of community and connection within the McGill and Montreal communities. And we do this by helping you prepare for your arrival at McGill and connect you to the resources that you're going to need along the way. So, for example, we'll be offering you various webinars throughout the summer to answer all of your questions as you're preparing for your arrival to McGill. And we have a great team that can also be reached for individual appointments to help you navigate any resources that you may need in your first year and beyond. And we also have a team of Ask McGill student navigators who are here to answer your questions, whether it be by phone, email, or even in person. You will see them on campus in August. They have their signature Ask McGill flag backpacks. So if ever you have a question, don't be shy. Feel free to approach them and ask them your question, and they'll help you guide you in the right direction. We also help you explore peer support and mentorship programs, such as our new Student Buddy program, which is live for applications. So if you're interested, you can sign up, and we'll pair you with an upper year student mentor. We'll pair you during the summer so that you can start asking them questions before you even get to McGill, and they can help guide you from a student perspective. So we also put on a lot of activities for students, the biggest and most exciting of which is going to be orientation this year, taking place from August 26th to August 28th at the downtown campus. So that's a little bit about CLEI. I'm going to hand it over now to Sarah, who will present on the PGSS Health and Wellness.
Thanks so much, Maya. So the PGSS stands for the Postgraduate Student Society. So this is an organization that's run by and for students, and it's composed of a variety of elected elected student representatives. So I'll touch on throughout this presentation a bit about our structure, our general services, but mainly I'm going to focus on the health insurance plans that we offer. So let's go into it. So today I'm going to talk about the student leaders, the various events under the health and wellness portfolio, as well as the PGSS health and dental plans, and then ways that you can get involved. We're actually going to hold the questions till the very end. So these are a few of the faces that you might see if you come to some of the health and wellness events. So Shalini, Natalie, and Nega are all students that will be running events and also doing advocacy work on your behalf. So they're all graduate students that take on work throughout the year and have a mandate to plan events and also support in making improvements to the services we offer. So some of the events that you could look forward to if you're looking to connect or just develop some skills. Here's an example of some of the ones that we did last year and throughout previous years. So we usually run some insurance webinars, such as this one. We also hold some throughout the year, especially in orientation season. And we do a lot of fun, like outdoor types of events, social things like dragon boat racing, hiking, all sorts of activities that can help you get acquainted with Montreal and also other graduate students. So you can check out our website or follow us on social media to keep up with that. But we'll also be sure to be spamming you with emails throughout the year, so you can also just check your inbox. So if you're looking for information after this and you want to follow up more about PGSS specific resources, you can head to our website. Under the health tab, there's a tool that can help you navigate like the insurance plans, as well as specific resources available to our members related to mental health, as well as peer support resources, such as the Graduate Peer Support Network. So, but the main thing that I want to talk to you today about is the PGSS Health and Dental Plan. So these are actually two separate plans, which are supplemental health insurance and offer extended health benefits to all master's, PhD, and certain eligible postdocs. So this extended health coverage includes access to psychologists, glasses, like vision care, dental cleanings, prescriptions, just to give you a bit of an idea. And specifically for the health portion of our plan, I want to highlight that this is only for students or individuals with the Canadian Provincial Health Insurance Plan. So if you're coming from another province or if you're based in Quebec and you already are on one of those provincial health insurance plans, then you'd be eligible to use the PGSS health plan. But if you're an international student, make sure that you tune out the health portion of this and then you only focus on the dental portion, because the dental plan is all graduate students are automatically enrolled in our dental plan, but only Canadian or Quebec students are enrolled in the health portion of our plans. So there's two different plans within each. So you can assume that you'll, sorry, my coffee is still kicking in. Okay, so there's the Enhanced Care Plan, which is what all members are automatically enrolled in, which offers higher coverage at a higher cost. And then you also have the option, if you'd like, during the first portion of the year, during our change of coverage period, you can lower the cost by lowering the coverage. So you can check out the Student Care website to compare what the different coverage looks like. But this is one option for you to save a little bit of, of cost. So what does the automatic enhanced care offer? So first off, who's eligible? All full-time, part-time, or additional session or non-thesis extension master's or doctoral students who register in September or in January and are paying Canadian or Quebec tuition. So pretty much all master's or PhD students that are enrolled at the start of the term. That's really important. So if you're not if your registration isn't finalized until a little bit later into the semester, so mid-fall semester, you might not automatically be enrolled. So it's good to check your Minerva statement to see if you're automatically charged. And if not, you can self-enroll through the Student Care website. It's actually also going to be changing. So Student Care is our insurance broker. They're going to be changing the name to Alumo this year, so you might hear me saying both of those throughout the presentation. Yeah, so if you're enrolled at the start of the semester, you're going to see those charges automatically on your tuition statements. And you can either decide to keep them, or if you want to opt out, you're also welcome to opt out. They're not mandatory. And then in addition to master's and PhD students, certain postdoc fellows are also automatically enrolled as PGSS members and charged our plans if they're registered at the start of the semester. I'll just note that if any of you are postdocs, it's specifically the non-unionized categories. McGill also has on their website a chart that's helpful to determine which type of postdoc you are. So I encourage you to look for that chart, or you can reach out to me afterwards as well for help navigating your category. As mentioned, any international master's or PhD students who are registered in the start of September or January are only automatically covered in PGSS's dental portion of the plans that we offer. If you're a Canadian or Quebec student, you'll be also registered in the dental plan as well. So you're not automatically covered, again, if you register partway through the year. So if it's October when your paperwork finally gets like all sorted through and that you get registered, then just make sure that you're, if you do want to have the supplemental health coverage with PGSS, that you're self-enrolling through the Student Care or Alumo website. You can also find all this on our website as well. So if you're not really sure where to go, we can always help redirect you. And yeah, the other thing that you can do at the start of the term is if any of you have children or spouses that you'd like to enroll, you can extend your coverage as well to them. So there's additional cost. And again, that's really in the start of the term that they do those special enrollments. So usually by before the end of September is when the coverage, the change of coverage period lasts. Yeah, so we can move on to the next slide. So this will give you a sense of the different costs. So looking at the first chart above, that's what the automatic rate is. And then below is the basic plan. So if you wanted to lower your coverage for a lower cost, that's the other option. And then it also gets divided into columns of the full year. So that's what most of you would be expecting to see if your enrollment is starting in September. And then the winter column is if you're expecting to be starting in January. There's no option to reduce it to only a part year if you're enrolled in September. So the options for you if you start in September is either you can keep the plans or you can decide to opt out, but you can't sort of do like a halfway rate. You do have the option if you want to keep only the health or just the dental, you can kind of mix and match and determine what suits you. So you'll see these on your Minerva e-bill. So how to opt out. So again, the change of coverage period will be approximately mid-August until late September for the fall students or fall registration. And then if you're beginning in January, it's going to be mid-December to late January. These dates on the screen are actually just approximate, but the exact dates will be released in July and then advertised to you through our website. You'll get through emails as well directly from us and the insurance broker. And again, the way to opt out or to change your coverage, if you want to add any family members, would be just directly through the student care website. So they have a form that you can fill out. And then if you're ever having any issues navigating this, we're here at PGSS to help support you so we can follow up with them and make sure that you get the support that you need. So submitting claims. Sometimes you're going to be able to use the plan directly if you're visiting a clinic to do direct insurance billing. So you can actually download a PayDirect card from the student care website. And then you can print it off and just fill in your 9-digit student ID number. So you'll get that from McGill. I imagine you've maybe already received it. I hope I'm not wrong about that and causing confusion, but if not, you'll receive that when you first start. And then you can put that 9-digit number into that card and then present it to the clinic to do direct insurance billing to avoid having to pay out of pocket. But some practitioners do require upfront payment. So you can then otherwise submit a claim online. So the student care website has the various options for you to do that. You can use their directly through a web browser or through an app on your mobile device. And again, the student care team has agents that you can talk to if you're confused about what's covered or if you need just assistance navigating how to submit a claim. So you can call them or submit a form online and get direct support via email. But yeah, those are the two main options. You can download the card and present it to the practitioner when you go, or you can submit a claim afterwards. So you hold on to the receipt and then submit the claim online. I do recommend that if you're ever, for instance, planning to get like dental care, if you're getting a cleaning, it's good to call the clinic in advance or to look up online whether or not they do direct to insurance billing, just so that you know and you're prepared before you go and visit and you don't get some kind of unexpectedly large charge. Yeah, there's also the dental clinic or dental clinic network, as well as the other like healthcare networks that our insurance broker offers where you can get additional discounts. So in terms of like what that looks like as a percentage, like say sometimes the plan, our base plan will cover 70%, and then if you go to a specific clinic within the network, it might offer another 20 or 30%, helping you get more full coverage on the claims. Another service that's available to you as a graduate student through your student fees with PGSS is the GuardMe Student Support Program. So this offers you unlimited real-time support with counselors, and really you can access it at any time from anywhere. And there's a variety of ways that you can access it. So through the support app, you can call or visit their website. And they have a variety of different tools and many different languages that you can access it through. So I encourage you to all check that out before you start your semester so you know what kind of resources of support are there for you. Next. And then there's also the Digital Doctor Program, which is a virtual health care service available 24/7 and provides unlimited access to Canadian licensed general practitioners through the Digital Doctor website, which is powered by the Maple app. So again, this is another fee, like all of our services that we offer and charge fees for, it's optional. So you can opt out during the change of coverage period at the start of the year. It's before the Minerva opt-out date. So just make sure that you're checking your fees and deciding whether or not you want to keep the service. But it does offer you quite a bit. So it gives you direct access to speaking to a doctor or a nurse, and it's pretty great. It's very low wait time. It's usually, I think, on average about 10 minutes waiting. So it's a lot faster than having to go to a clinic in person, and they can help you get prescriptions or diagnosing online. So I really do encourage everybody to check this out. The charge for this is $25 per year. And then there's also an add-on for mental health coverage, which is $30 per year. And you can find out more about this through our website. And then if you're interested in getting involved in any of the work that PGSS is doing, you can join the Health and Wellness Committee. So you can reach out to that email you see on the screen and help organize events and initiatives to help connect with your peers and organize health and wellness events throughout the year. All right, well, thank you everybody for listening.
Thank you so much, Sarah. I'm going to hand it over now to Victoria and Elizabeth for the international health insurance portion of our presentation.
Perfect. Thank you so much. Yep. So I'll start this portion off. So we're gonna go over the International Health Insurance Plan, what are my health insurance benefits, how to submit claims, essentials that you should know, and at the end of the presentation, we're gonna answer questions. So to start off, the International Health Insurance Plan is a group plan, and it is if you're an international student, you'll be automatically covered by the plan, and it is mandatory for your CAQ and for McGill Senate. It's provided by Medavie Blue Cross. A contract, excuse me, a contract year begins from September 1st until August 31st. However, new students will be able to get coverage as of August 15th, so 2 weeks prior to the start of the term. You will be able to get your IHI card in Minerva, and we have about 11,000 contracts per year with of the International Health Insurance Plan. So as mentioned, it is mandatory for your CAQ application. So when you first apply for your CAQ, they're not going to ask for proof of health insurance. However, if you renew your documents, it is a document that they might ask for. So the cost of the plan for the 2026-2027 academic year is as followed. So if you're an international student and you're coming alone, the plan will be $1,212. If you're coming with one dependent, either a child or a spouse or a common law partner, it'll be $3,726 for the both of you, and that's for the entire year. And then we have family plans as well. So the family plan is either yourself with 2 or more dependents. So it could be yourself and 2 children under the age of 18. It could be yourself with one spouse, and a child. So that'll be $7,080 for the entire year. This international health insurance plan includes basic coverage as well as supplemental. Basic meaning provincial replacement. So we will have both. And there are direct billing programs that it offers. So one being with the McGill Student Wellness Hub, as Elizabeth mentioned earlier, it's the clinic on campus. So you'll have direct billing with them, with the MUHC hospital, so the McGill University Health Center, which is around the downtown campus. Then we have Maple Virtual Care, and as well if you do blood tests at the Byron Diagnostic Clinics. So to activate your coverage, you can activate your coverage in Minerva as of August 1st. To do so, you're going to go to the main menu in Minerva. You're going to go to the student menu, click on International Health Insurance Form for Students, select Confirm Coverage from the drop-down menu and hit Submit. After activating your plan, you can print or save your IHI card, which will look something like this. It's important to have it on you in case you need it. So you can print it, you can keep it on your phone, but it's important to show it when necessary. If you do not activate your plan, you will automatically be activated as a single coverage. Next, we have the Medavie Blue Cross mobile application or web portal. So through this portal or app, you'll be able to submit your claims and forms. You can fill out your direct deposit, so your personal bank account, and you can also get your prescription drug e-card. So upon activation, you'll have to wait about 7 business days, and then you'll be able to log in. Another thing is that some of you may not have access to the Medavie Blue Cross app on your app store, because I believe it's like territorial. So if you have like a Canadian phone in regards to like an international phone. So if you don't have the app, that's okay. You can just use the website portal instead. It's the same thing. Yep, so we're going to go back to adding dependents. If you're coming with your dependents, you can add them to the IHI plan when you're activating your coverage in Minerva. So instead of activating it, you're going to go to add dependents from the drop-down menu instead. If you already activated your coverage and you can't add your dependents in Minerva, that's totally fine. You can submit a ticket through the IHI portal, which is how we communicate. So you can open a ticket there and we'll be able to add them to your plan instead. After you activate your plan and they're added to after your dependents are added to your plan, your name will appear as well as your dependent spouse or common law partner. Their children's names will not be on the IHI card. However, they'll still be covered by the plan. And another thing, if you do not add your dependents to the plan, as mentioned, your coverage will automatically be single coverage. So that's why it's important to add them when you have to. So minors of international students or minor international students are eligible for the provincial healthcare plan, which is called RAMQ, if you are younger than 18 years old. So if your child is covered by RAMQ, then it's not necessary for them to be covered by the international health insurance plan. I also forgot to mention that when you're adding your dependents, your children must be younger than 18 years old. So they'll be covered until they're 18. As soon as they turn 18, unfortunately, they won't be eligible for our plan anymore. So Canadian non-residents, this is something that we are covering basically some Canadians in this case. Although we only cover international students, this is the exception where we do cover some Canadians who come to Canada and do not have provincial health care, or they're a new permanent resident and they don't have, again, the RAMQ yet. They're waiting on it. These students are eligible to opt into our plan. It would be through the IHI portal again, and then Canadian non-resident sign-up form. So yeah, again, if you're a Canadian with no provincial healthcare, this would be for you. The deadlines are as followed. It would be September 30th for the fall term, January 31st for the winter term, excuse me, and May 31st for the summer term. So you can opt in per term. If you still didn't get your RAMQ, you can extend it and opt in for another term. This plan is not mandatory, although it is encouraged given that it'll be the provincial healthcare, so it'll be basic coverage as well as supplemental coverage. So we're going back to what's covered. As I mentioned, there's basic healthcare that's covered as well as supplemental coverage. So there'll be a 1 million overall lifetime maximum coverage. You'll be covered for hospitalization, physician visits, diagnostic testing, surgery, off-campus clinics, which would be 3 times the RAMQ rate, on-campus clinics, like the McGill Student Wellness Hub. And the McGill Student Wellness Hub is only for McGill students. Unfortunately, it's not for dependents. You'll also be covered for diagnostic tests, maternity, accidental dental care, medical evacuation, and vision care. For the supplemental coverage, you would be covered most likely at only 80% for these services. Prescription drugs with an out-of-pocket maximum of $1,161. Vaccinations with a maximum of $1,000 per contract year. Charges of physiotherapy with a maximum of $1,500 per contract year. Charges of osteopath, podiatrist, chiropractor, local ambulance services as well. And I am going to pass this on to Elizabeth now.
Thanks, Victoria. So I'm going to spend just a few minutes talking briefly about accessing healthcare when you're here in Montreal at McGill. I know there are other webinars that go into this in much more detail, which is why I'll do a broad overview, but just to kind of familiarize yourself if it's not something that you've learned about already. So of course it's come up a few times, but the Student Wellness Hub, which is the on-campus clinic and has a presence both downtown and at Macdonald campus for those of you who are studying on the Macdonald campus. So again, to access the Student Wellness Hub, you do need to be a registered McGill student who's paying the student service fees and has access to, international health insurance plan if you are an international student or your provincial insurance. I wanted to mention as well that if you are a postdoc, we can always post the link in the Q&A later, but you would want to verify based on your individual situation whether you would have access or not, because it does sort of depend on the category of postdoc. So a note on accessing services at the Student Wellness Hub. So it's open Monday to Friday, not open on weekends, but open during the week. We have many, many different clinicians. So there are general practitioner type doctors. We do have psychiatrists, we have nurses, we have laboratory technicians as well, so you can get lab work done at the Student Wellness Hub. We have dietitians, and we also have a whole variety of mental health professionals. So myself, for example, I'm a local wellness advisor for international students. So I meet with students to talk about their mental health or their wellness and help them access services. We also have a big team of counselors. So definitely take a look at the website, familiarize yourself with the different services that we offer, and booking appointments for the most part is done by the phone, although there are certain things that you can book online as well. So just a note on resources in the community. So there are a few different resources that is just important to know about. Maya, if you can just make the text appear, thanks. So the emergency number, in case you're outside of Canada and it's different in your home country, the emergency number here is 911, and that's for police, fire, or ambulance services, and 911 would be the number to call in the event of both mental health emergencies and physical health emergencies. We also have another phone number, which is 811. And in Quebec, that has two features. So it has a feature where you can speak with a nurse and ask questions related to like health questions. And it also has a second option called Info Social, where you can speak with a social worker and ask questions that are more related to like your psychosocial situation or access to resources, for example, within the Quebec community. And then, of course, there's also the Montreal Suicide Prevention Center, which offers 24/7 support by phone, text, or chat in the event that you're having thoughts of suicide, or if you're concerned about a friend, you can reach out to that phone number as well. So like I mentioned, the Student Wellness Hub, while available to students, is not going to be open every day or every hour of the day. So it's possible that you may need to have access to care at a clinic off campus. So particularly for international students, most off-campus clinics, sorry, are not going to be equipped to bill the international health insurance provider directly. So you can expect to pay upfront and then be requesting a reimbursement from the insurance company after. And for non-Quebec students, so students who are coming from a different province, it's also worth kind of informing yourself as well with your home province about using resources in Quebec. So again, if you're looking for where are these clinics that are in the Greater Montreal area, the Student Wellness Hub website has a list of community resources. So this is kind of like a snapshot of the page on our website. And then there's a drop-down menu. So there's like many different categories. So there's like one that's local medical clinics. There's one that's like finding like local therapy in the community. So definitely take a peek, and we suggest kind of looking in advance so that you familiarize yourself with where to find this information, so that you're not looking for it in a moment where it feels a little bit more urgency pressure. So there are many hospitals in Montreal. Many places you'll be able to access care in both English or French, although depending on which hospital and which part of the city, the staff may be more or less comfortable speaking English. Bring your health insurance card, and many hospitals are equipped to accept direct billing to the International Health Insurance Plan if you are an international student. And for those of you who are not too familiar with our emergency rooms here, you can expect kind of a waiting time at the ER because they're doing like triage based on level of need. But those emergency rooms are something that you can access any time of day for any sort of urgent medical need. The closest hospital to the downtown campus, although by no means the hospital that you necessarily need to choose, is the Montreal General Hospital. It's actually walkable. It's about 10-15-minute walk from the downtown campus. And it's part of a network of hospitals that is kind of connected to the McGill University. They're called the McGill University Health Centers, I think. And so in the hospital, for example, they'll have a lot of staff that do speak English and are able to provide care in English. And for those of you who are going to be at McDonald campus, the closest hospital is the Lakeshore General Hospital. Not walking distance, but a relatively short drive away. So just take note of the name of the hospital if you're going to be at McDonald campus for your studies. And just briefly now, I'm going to go through a few other community resources that are for international students that are on the International Health Insurance Plan. So Byron is a lab that you would have access to. So for certain laboratory work, if you can't go to the Student Wellness Hub or it's not convenient for you for whatever reason, you do have the possibility of going to Byron, and they do direct billing with the International Health Insurance Plan. And you also have access to a virtual doctor appointment through Maple. They also bill the insurance company directly, the Medavie Blue Cross Insurance Company. And there's two types of appointments that you can choose. So you can choose an appointment for physical health and meet with a doctor to talk about a physical health question, or you can also choose a mental health physician appointment and speak with a doctor who has more of an expertise in mental health about your concerns in that area. And so if this is something that you want to do, just make sure that you register for the Maple app through the International Student Services link, because you would basically need to link your account so that you're not being asked to pay with a credit card. And then you also have access to ADHD assessment and support through a platform called Beyond ADHD that offers virtual services. So this does not do direct billing, but there is kind of like a preferential rate if you're on the International Health Insurance Plan, and you can look for more details following the QR code. And Victoria, I don't know if you want to jump in to join me for this slide. It's just our kind of overview one.
Of course. So the takeaway message would be to review the Medavie Blue Cross Handbook. Again, this is for international students only or Canadians that don't have provincial health care. If you have coverage questions while you're here, you can contact Medavie Blue Cross directly. Their information is on this slide as well as on our website. It's also important to familiarize yourself where you can access healthcare before you find yourself not well. So there's a list of options. There's a list of options on the McGill Student Wellness page, as well as the International Health Insurance page. So you can contact ISS directly on details of your coverage and claims, or you can contact the Wellness Hub directly for accessing healthcare. And if you have additional questions or you want more details, you can register for the upcoming IHI and Accessing Healthcare in Quebec webinar taking place on June 16th.
All right, so we do have some time for questions, and I do have a lot of questions here in the Q&A. So first of all, question for Victoria and Elizabeth regarding the international health plan. So we're asking if a student is an international student but has RAMQ coverage, are they automatically enrolled in the PGSS health and I guess this is a question for both. So are they automatically enrolled for the health and dental plan with PGSS, or should they enroll to the IHI?
That's a good, I can kind of maybe start it off and maybe Sarah can finish it. So if you have provincial health care, you may request an exemption from the International Health Insurance Plan. If you're an international student, you will be automatically charged the dental insurance plan, but not the supplemental. So you can request an exemption from the IHI plan, and then maybe I'll have Sarah kind of answer regarding the supplemental and the dental portion of that question.
Sorry, can I just get the initial question repeated?
Yeah, of course. So the question is, if an international student has a RAMQ coverage, are they automatically enrolled for the health and the dental portion of the PGSS plan?
So they would definitely be charged the dental portion, but I actually want to double check. I'm not entirely sure. I don't think that I think it usually comes down to whether or not they're paying Canadian or Quebec tuition rates, whether or not they'd be charged the PGSS health plan. So I'm sorry, I just don't want to I don't want to give the wrong answer. So what I could do is also offer my email and follow up with somebody. So I'll reply that in the chat.
Great, thank you. I also saw a couple of questions regarding being part-time and whether this would affect coverage.
It if you're an international student and you're part-time, you will still be covered by the plan as long as you're registered. However, if you're not registered or you're deregistered, you take a leave of absence, it's important to get in contact with us if there's any change in your registration. But if you're an international student and you're registered, even if it's part-time, you should still be covered.
Yeah, and same for PGSS, like part-time students are charged automatically our plans if they're eligible. So that Canadian Quebec students will be charged both the dental and the health portion of the PGSS supplemental plans automatically, and then international students will be charged just the PGSS dental plan automatically.
Great. And then there's a question whether the annual health insurance fee is charged at the time of activation. I see, Sarah, that you answered this one already about the PGSS plan, that it is charged automatically to all eligible students who are enrolled at the start of the fall or the winter. But for the international health insurance plan, is that also charged at the time of activation?
So as soon as you are registered, as soon as you're registered, you would be billed for the international health insurance plan, and it'll be with the rest of your tuition fees.
Perfect. I have a question here regarding the deadline for summer, which we mentioned was May, and that is in regards to the international health insurance plan. The student activated their coverage before the end of May. However, it was later canceled because they had not registered for their program, since registration had not yet opened for their program. So they reached out to the team and was advised to contact you, and they're just wanting to get a confirmation whether this is a normal process for students starting in the summer, if there's anything that you can advise.
No, good question. I would need to look into that. Yeah, so if you don't mind writing to us again, like we can kind of look into it. But normally, yeah, if you're not registered, you won't have access to the health insurance plan just yet. And if you get deregistered, it is likely that if your I don't know, your registration gets changed or something, yeah, your plan could be terminated as well. So yeah, maybe get in contact with us and we can look into that again.
Perfect. And then we have a question about out-of-province students. So just asking if the health plan works if they are under a different province. So if they're under provincial coverage from, let's say, Manitoba.
Yeah,
So I
so
can,
go
oh,
ahead.
you want to go ahead? Yeah, go ahead.
If they're an out-of-province student, you'll be charged the PGSS health plan, the supplemental plan automatically, as well as the dental plan. Sorry, maybe I misunderstood the question though.
No, I think that's part of it. I'll just add that like when you're at an out of province plan, normally you stay covered under the home province's like RAMQ equivalent. What I generally hear is that you do need to reach out to your home province and ask them, like, do you need to notify them that you're going to be studying in Quebec? So that's just something to verify, because Canadians who are kind of traveling within Canada do have access to coverage in the province that they're in, but normally you do have to advise your home province of your plans and just check if there's like anything specific about what they cover versus what they don't cover when you're in Quebec. And I think it does vary from province to province. So yeah.
Yeah, and there's different rates of what is kind of the sort of customary charges that they expect. So it's good to compare what your home province will expect to cover versus what the rates might be here.
Mm-hmm. Great. And then, Sarah, we have a question regarding the dental plan coverage and what exactly does it cover? Specifically, would it cover any wisdom tooth extractions?
Off the top of my head, I'm not exactly sure about wisdom tooth extractions. I'm just gonna actually take a second to pull up the the website for myself. So the website currently is studentcare.ca/PJSS. So I'm going to take a glance at what the overview of the dental coverage is for. Okay, so for instance, in general, like preventative services, so that could include things like exams, radiographs, other preventative services like oral hygiene, polishings. These are generally covered at 70%. Basic services, endodontics, periodontics, so this could be like fillings, restorations, maintenance, or removal of dentures, even some oral surgery is covered at about 50%. So I think it's possible that that might fall under there, but to be certain, I would recommend reaching out to our insurance broker directly. So I'm going to drop their contact in the chat so that you can follow up with them to confirm if there's any specific coverage that or any specific care that you're expecting, like work that you need to have done. You can consult with them to know, is it covered and at what percentage?
Right, great. We have a question about annual body checks and dental scaling. Are those included for full-time PhD students? And if so, how to book an appointment? And for people who with long-term diseases, how do you get referred to a specialist?
Oh, is this for international students?
I just didn't hear the first part of the question also.
Yeah, I didn't
know
hear it either.
others did.
Sorry.
Yeah, so the student didn't specify whether it was for international students or Canadian students. The question is more so about how to get appointments for regular checkups, so annual body checks or dental scaling, things like that. How to book the appointments, and then also how to get referrals to specialists when needed.
So I can answer part of that question. One thing is just to mention that in Quebec, there is no framework for annual physicals. Like it's not really something that in our healthcare framework is really very common, let's say. But what you can do is you can kind of book an appointment, in this case, the Student Wellness Hub, because you want to have XYZ sort of discussed, and you can meet with the doctor that way. And the same thing too, if there's a chronic condition and you want to have access to care. Here in Quebec, we definitely suggest that you can book an appointment with a general practitioner at the Student Wellness Hub, and they can discuss your specific situation, because whether you get referred to a specialist is going to kind of depend on what you discuss with that doctor, if that makes sense. So definitely don't hesitate to book an appointment when you arrive. Or Maple is another option too if you're an international student that you could speak with a doctor. Yeah.
Maple's a virtual doctor, so if ever you can't get an appointment at the Student Wellness Hub, Maple is a virtual doctor that's covered under the International Health Insurance Plan. Wait time there isn't much of a wait time. From our understanding, they usually see students right away, and you'll be able to talk to a doctor virtually.
And I'll also actually just jump in here to flag that if you're an international student, you actually have a bit of a duplication in terms of coverage there. As the Postgraduate Student Society introduced a similar plan, the Digital Doctor Plan, which is also powered through Maple. So you can actually sort of look and decide if you want to opt out of, for instance, like the Digital Doctors Plan, since you already have Maple with International Student Services, then that's an option for you to save some money. But yeah, PJSS also offers that virtual healthcare access. So seeing doctors over the phone, over a video call, and it's pretty efficient in terms of getting a consult. And if they can't support you, they'll also refer you out to somebody in person in the city.
Right, I see a question. Oh, sorry, go ahead.
Sorry, I was just going to say, I think there's just one piece we didn't answer, which is about like the dental cleanings or checkups. So do you know, Sarah, if that's covered under the dental plan? I don't know.
Sorry, I'm just scrolling through the chat and trying to keep up with things. Sorry, could you repeat which
Uh,
question we're on?
well, that question had like multiple parts, and one of them was just I asked about dental scaling, which I'm thinking is maybe just like dental cleaning, although I'm not sure.
Yeah, so if you have any questions specific to what types of dental care is covered, I would really encourage you to look at the PGSS or sorry, at the student care website and scroll through. So it's studentcare.ca/PGSS. If you go to the dental tab on that website, they have a list of the percentage of what's covered and which different types of procedures are covered. So usually there's a certain sort of maximum per year that you can claim under eligible services. So, and then again, if you have specific questions like particular procedures that you expect to have done, I would encourage you to speak directly with one of the agents at the insurance broker. And I've dropped their link in the chat in the Q&A, I think already. So you can go look at that link to get your specific questions answered.
Great. I do have a question regarding coverage after graduating. So if you've paid for coverage for the full year, September 1st to August 31st, to graduate in April, are you still covered until August 31st, or are you no longer covered once you graduate at McGill?
If you are an international student, you will still have coverage until August 31st. Yeah, so even if you're registered, for example, the fall term and you graduate in the fall term, you'll still have coverage till August 31st the following year.
Yeah.
And
It's,
oh, sorry.
no, go ahead, Elizabeth.
I was just going to say for the Student Wellness Hub, once you graduate, you don't have access to the services anymore. It's just something to be aware of.
And for PGSS plans, you'll continue to have coverage for the full policy that you've been enrolled in or paid for. So if you are enrolled in the fall, pay for the full year, you'll continue to have coverage, even if in this instance, like if you're finishing up in April, you'll still have coverage until the end of that August. Although if you do end up graduating in December of a specific year, you also have an option to opt out of the winter portion of the plan. So if you decide that, okay, you might have a job lined up and you're gonna have employee health benefits, then you could opt out of the PGSS plan for the remainder of that year. But it's only for students that are graduating in December. So just something else to flag. And then for that, you'd speak directly with the insurance broker for assistance.
Great. Thank you so much. So I'm seeing a couple of questions regarding contact information. So I'm just going to post this slide here for the Health Commissioner's email address at PGSS, the Postgraduate Student Society. If you have any questions regarding the PGSS Health and Dental Plan, you can reach out to the Health Commissioner. Sarah, I don't know if you want to add anything about that.
Yeah, also my contact specifically, I've shared on one of the comments, but I should have also added it to the slides. Sorry that honestly the slides were edited a bit late before this presentation, but mine is studentlife.pgss@mail.mcgill.ca. So I'll just share that under the more recent comment about that. So you can find that there.
If you want, you can create it as a new post, Sarah. Just write it at the top, and it'll be published. And then if ever you have any questions for Clay in general and preparing your arrival to McGill, I also have our contact information listed here. So you can send us an email at firstyear@mcgill.ca. So this would be general resource providing throughout your journey in preparing to come to McGill. You can also follow us on Instagram, and we also have a Discord for the entering class of 2026-2027, which is an online community for first year students who are coming in. And then I'm also going to go backwards to the start of the presentation for Elizabeth and Victoria's information. So their names are Victoria and Elizabeth, and I believe they can contact you. You have booking links to your websites, is that correct? And for the ELWAs, there's usually a booking link. I don't know, Elizabeth and Victoria, if you want to pop that into the chat for anybody, because I did see some a little bit more specific questions that might be better answered either through an appointment or through an email. So
Yeah, I'll put the general Wellness Hub email in the chat as well. So if you have questions for the Wellness Hub, you can email that email, and I can put the link for how to book different types of appointments as well on my end.
perfect. And then there was, oh, sorry, go ahead, Victoria.
Oh, no, I was just saying I added it as well. I've added the contact to write to us.
Perfect. And then we had a question regarding the fees for international students. So the question is, does the 1,212 Canadian dollars plan for international students include dental insurance, or is that the additional dental plan from PGSS? So is that the addition, there would be an additional fee?
It's just the international health insurance plan. There is an additional dental plan with PGSS. So our plan does not include dental insurance. It only includes accidental dental. And in that case, you will need to be hospitalized. So the dental insurance is separate from that fee.
Yeah, Maya, do you mind actually going back to that slide near the top of the presentation with the costs for PGSS maybe? Sorry, it's way back there. Almost there, yeah.
Oh, there.
Yeah. So yeah, the fee is on here. So for dental for the full year is $276.52. So that's the PGSS supplemental coverage there. So if you're thinking about getting cleanings or like cavities billed, that sort of thing, that's within the PGSS dental plan. Yeah, and it's optional. So if you decide you don't need to have dental coverage in Canada, maybe you're gonna be going back home for that. You can also opt out of the PGSS dental plan at the start of the year.
Perfect. Thank you so much. And we have a question regarding registering on August 1st. I believe the question is regarding the International Health Insurance Plan. Just confirming that you do have to register on Minerva, or will it be automatic like the PGSS? So I believe the answer is no, but I'll let Victoria specify.
Right, so you'll automatically be billed for the plan, but as of August 1st, you need to activate your plan in Minerva. If you don't activate it, it will automatically be activated, I believe, sometime in October. So it's just best to activate it right away. If you want your dependents on it, if you want just yourself, so that you avoid even delays with the app and the Mediview Blue Cross app to submit claims. So it's just best to activate it as soon as possible.
I also see a question about enrollment dates. I don't know if I can just jump in to answer that.
Yeah, go ahead.
So if somebody's enrolled in the summer term, they won't be charged for the PGSS membership or the PGSS insurance plans until the fall semester. So if you've started in May, you're not going to be seeing PGSS fees for insurance until the fall. So that's probably going to be around mid-August that you're going to see those charges on your Minerva e-bill. So that means that any PGSS plans that you're eligible for, you wouldn't start having coverage until September.
Perfect. I don't see any other unanswered question. There might be some that were answered by comments privately. If there are any last minute questions, now is the time before we kind of wrap up our webinar. I don't know, Elizabeth, Victoria, and Sarah, if you had anything else maybe that you kind of wanted to add.
Maybe one thing I just realized I didn't mention is while I've talked about the insurance broker, who's our intermediary, the actual insurance company that PGSS plans are with is Green Shield. So that's probably relevant.
Great, thank you. All right, so I don't see any new questions kind of popping up. So I think this is a good point to kind of wrap up our webinar today. Again, if ever you do have any questions that you can think of, please feel free to reach out. If you have any questions about other student services, or you have a question and you're not sure where to go to, feel free to reach out to Campus Life and Engagement at firstyear@mcgill.ca, and we'll be happy to redirect you to the resource that can best help you essentially with whatever issue you're going through. Thank you all so much for being part of this presentation. Thank you to Elizabeth, Victoria, and Sarah for delivering this lovely presentation to all of our students and sharing this very, very important information. All right, I think that's pretty much it. Unless anybody has any last words, I think it's a good point to end it.
Thank you, everyone.
Great. Bye, everyone. Have
Thanks,
a lovely
everyone.
rest of your day, week, wherever you are in the world. Have a good one. Bye-bye.